Hello, and welcome to High Tech Answers. Today's recording is part of a continuing series on the final rule and deals with the specifics of the various CMS incentive programs for eligible professionals. Before we begin, we've got a couple housekeeping issues. One is that on-demand webinars and recordings are best heard through a headset so that you can control the volume. There's a download that accompanies this presentation, so you may want to print that out so you can take some notes as we go along. And finally, there are some other related links and documents found in the final rule section in our subscribers library to support this recording. With us again is Bill Orovich. Bill is Managing Partner of WTO Associates and Chief Analyst for High Tech Answers. He's got 26 plus years in the healthcare IT space. And Bill, welcome back.
Thank you, Karen. Good morning, everyone. We have a very exciting webinar today, and it being focused on the final rule, the incentives for Medicare and Medicaid incentive program, and what we'd like to do this morning is to go into the various qualifications for the various programs to help you make the right decision based on your particular practice. But before we go any farther, we'd just like to remind folks that the CMS incentives that are being offered for meaningful use of certified electronic health record are being supported by the HITECH Act. The HITECH Act being a part of the American Recovery and Reinvestment Act that was signed into law in February of 2009. And what this, among other things, that the HITECH Act supports is the incentive payments for eligible professionals and eligible hospitals who demonstrate meaningful use of a certified EHR technology. The particular rules, the final rule here that was published at the end of August is now the regulations went into effect September 27th of this year, and we hope that you will enjoy this webinar as we go through and help you make that correct decision for your practice. Okay, just an overview. The final rule indicates a number of things. One, it provides the initial criteria for eligible professionals, hospitals, and critical access hospitals, what they must meet in order to qualify for the incentive payment. Like most of our webinars, we will focus solely on the eligible professional qualifications. We'll go over the calculation of the incentive payment amounts through a table. We'll also touch on some of the payment adjustments under the Medicare for covered professional services and inpatient hospital services provided by EPs. And we'll also want to touch on some of the other program participation requirements in this webinar. One thing we want to touch on as well before we go any further is that there are a number of programs that you may or may not know or may be already participating in. One in particular is the e-prescribing incentive program. This was created by the Medicare Improvements for Patients and Providers Act, MIPPA. And if you are a Medicare provider, you participate in Medicare Fee-for-Service or Medicare Medical Advantage, you are not going to be eligible for the incentives, okay? The situation is that you could be eligible for one or the other, but not for both. Now, on the other hand, if you are a Medicaid eligible professional, you can receive both the Medicaid EHR incentive that we're going to be talking about, as well as the e-prescribing incentives provided by the MIPPA program. Okay, so definitely a little greater advantage for Medicaid eligible professionals. And you'll see more of that as we go through the presentation. One of the other programs that is also associated is the Medicare Physician Quality Reporting Initiative, otherwise known as PQRI. And eligible professionals are eligible for both this EHR incentive as well as the PQRI program. So that's a good thing. For Medicare EHR demonstration, okay, eligible professionals are eligible also for both, okay, and Medicare. Once eligible professional has selected a program, there's 3 programs that we'll go through. You're permitted to make a one-time switch from one program to the other. So that's a nice thing. If you make that selection and you find going through it, it's just not going to be the right one for your practice, you can make that one-time switch. Okay, so a lot of flexibility that's being offered here. Okay, so which program to choose? Okay, there's 3 programs. We're going to walk through the Medicaid program, and then after that we'll go through the 2 programs for Medicare Fee-for-Service and Medicare Advantage organization. Very first question that you need to ask yourself, did you perform 90% of your services in an inpatient hospital or emergency room setting? Okay, now here's the thing. If you did, then you're not going to be eligible for the EP program. Okay, it's going to be left up to your hospital that you are providing those services at. Okay, so that's the very first qualification. Where do you perform your services? Okay, so if you did not perform 90% at the hospital, let's go on to question 2 for further qualification. Okay, now the next question is, were at least 30% of the services that you furnished, were they to Medicaid patients in an outpatient setting? And if you were a pediatrician, did you provide at least 20%? Okay, so if the answer to that question is yes, then the next question we're going to ask is, are you a physician? Are you a dentist? Are you a certified nurse midwife? Are you a nurse practitioner? Are you a physician's assistant participating or practicing in a federally qualified health center or a rural health clinic that happens to be led by the physician's assistant? If that's the case, then you are most likely and are going to benefit most from participating in the Medicaid incentive program. Okay, if the answer is no, then we're going to go on to no for the percentage of your services. Then we're going to go on to question 3. If you were not one of those professionals that I indicated, then you're not going to be eligible for any of the programs for the EPs. Okay, so let's go on to question 3. If you did not meet that particular criteria of 30%. Okay, so the question is, did you practice predominantly in a federally qualified health center or a rural health clinic with a 30% needy individual patient population threshold? Again, if you did, and again, if you were also a physician, dentist, nurse, midwife, or practitioner, or physician's assistant in a qualified health center or rural health clinic, then again, you would most likely be successful and qualify for the Medicaid incentive incentive program. If you didn't, we're going to go on to question 4. Okay. The question, did you treat Medicare patients? Okay. If you didn't meet the criteria for Medicaid, then did you treat Medicare patients? And here, little different professional criteria. Were you one of the following? Were you a doctor of medicine or osteopathy? Were you a doctor of oral surgery, doctor of dental medicine, doctor of podiatric medicine, doctor of optometry, or a chiropractor? If you were, then you would most likely be successful in participating in the Medicare incentive program. Okay. One thing that you should note is that the professional qualifications for the Medicare program are different than those for the Medicaid program. Okay. There's more qualifying professionals in the Medicaid program than there are for the Medicare. Okay, so if you didn't treat Medicare patients, then the fundamental answer is that the EP program is not going to be for you. Okay, and you'll have to rely on your hospital where you practice, your hospital practice for that program. Okay, let's go on. So we've gone through, we've seen the basic selection criteria for one program over the other. What we present here is just a very high-level overview of the Medicare versus the Medicaid program. Okay, so the Medicare incentive program is federally funded, okay, and will be implemented. The Medicaid is voluntary for states to implement, okay? So that's something that we're going to want to check on with your state government if they are going to be participating in this program. Medicare program, the payments will go out until 2015 for providers, and payment reductions after 2015 will start to kick in. If you participate in the Medicaid program, there are no payment reductions. Okay, so again, much more leeway for the Medicaid program. Medicare, you have to demonstrate meaningful use in 1 year and all subsequent years. With the Medicaid, you can qualify for incentive payments after adopting, implementing, or demonstrating meaningful use in your first participating year, and then you're required to demonstrate meaningful use in subsequent years to qualify for the incentive. Now, the maximum incentive for the Medicare program is $44,000. Okay. For the Medicaid program, the maximum incentive is $63,750. So, again, Medicaid Medicaid program providing more flexibility, a greater scope of professional participation, as well as a greater maximum incentive that's being provided. The meaningful use definition is common for Medicare. However, for the Medicaid program, the states can adopt certain additional requirements for meaningful use above and beyond what the ONC has specified. Last year, for a provider to initiate the program for Medicare is 2014, and the last year to register is 2016. For Medicaid program, the last year a provider may initiate the program is 2016. So again, more flexibility, and the last year to register is 2016 as well. As I mentioned before, for the Medicare program, only physicians and subsection D hospitals and critical access hospitals are eligible. For the Medicaid program, 5 types of eligible professionals are Okay. All right, let's go a little bit farther about the Medicaid incentive program. Again, we identified that there are 5 types of professionals: physicians, dentists, nurse midwives, nurse practitioners, physician's assistants, okay, and cannot be hospital-based, of course. The qualifying eligible professionals must meet patient thresholds, as we saw in the very beginning in the qualifying questionnaire. 30% of your patient volume has to be receiving Medicaid. For a pediatrician, you must have 20% of your population. If you're an EP practicing in a federally qualified health area or a rural health community, you must have a minimum of 30% of your patient volume attributed to needy individuals, okay? Okay, so here's the payment schedule, okay? And as we mentioned in the overview, the maximum incentive payment for the Medicaid professional is $63,750. And as you'll see, depending on what year that you start the program, you register and then start reporting your results, 2013 all the way up until 2016, there was no reduction in the incentive payment. So this is a lot of leeway, a much more healthier incentive payment being provided for your particular practice. So, and this going all the way until 2021. That's really tremendous. Okay. Okay. Let's shift gears and let's look at the Medicare Fee-for-Service incentive program. Okay. Again, we saw earlier that the qualifying eligible professionals are different. It's a little bit more restrictive for the Medicare program. So we're talking about doctors of medicine or osteopathy, dental surgery or dental medicine, podiatric medicine, optometry, and chiropractors. Okay. The Medicare Fee-for-Service incentive program is subject to an annual limit equal to 75% of your Medicare allowed charges. The calculation of allowed charges is going to be based on your claims submitted to Medicare no later than 2 months following the end of the payment year. All right. The eligible professional in this program is entitled to the incentive payment for up to 5 years. Okay, shorter than the Medicaid program. After 2016, there are no incentive payments, where we saw the Medicaid program had incentive payments out to 2021. Okay. Okay, here is the schedule for the fee-for-service Medicaid payments. This program starting as early as 2011, next year, and a maximum of $44,000. Everything is good up until and including 2012, but starting in 2013, you're starting to see the reductions in the maximum amount of incentive that will be paid out. And by the end of 2014, that's it. Subsequent years, 2015 and beyond, there are no incentives. So again, big advantage for the Medicaid population. Okay, for those eligible professionals that are practicing in the professional shortage areas, the HPSA will receive a 10% increase in incentives, so a little bit of a bonus for the health professional in the shortage areas, 10%. So that's a nice thing. CMS considers predominantly for more than 50% of the eligible professionals Medicare-covered professional services in these particular areas. 50% will be based on frequency of services provided versus the percentage of allowed charges. Okay, so that's the qualification for the HPSA bonus. Okay, so for the HPSA, there's a little different schedule. If we factor in the 10%, so we have a maximum of $48,400, and similarly to the fee-for-service program, it's the same kind of time frame, the same kind of reduction, and then starting 2015, there are no more incentives. Okay, the third program, Medicare Advantage incentives. Okay, so you need to, as an eligible professional, you need to be employed by a qualifying Medicare Advantage organization, or you need to be employed or a partner of an entity that through contract with the qualifying Medicare Advantage organization furnishes at least 80% of your entity's Medicare patient care services to enrollees. Okay, so Medicare Advantage EPs must furnish at least 80% of their Medicare-related professional services to enrollees of the organization, and on average, at least 20 hours per week of patient care services. All right. Now, in this program, Medicare Advantage, the incentive schedule is the same as the fee-for-service schedule. Okay, the $44,000 maximum. Okay, so no particular change there. Okay, the computation and payments in calculating the Medicare Advantage EP incentive payments only covered professional services provided to enrollees of Medicare Advantage plans are offered. Okay, any service reimbursed by the Medicare fee-for-service will not be included in the calculation. Okay, so no overlap there. Okay, so those are the three programs. The qualifications, the differences between each, the clear advantages that we see with the Medicaid eligible professional, and some of the limitations for the Medicare programs. But all that being said, registration for these programs at the CMS website will start as early as 2011. You must be enrolled in one of the three programs. Now remember, you have the option that if you roll in one during the program, you can change once. Okay, so that's something to at least keep in your back mind. I would focus, try not to make a change. Those kind of things usually involve a lot of paperwork, but we hope this webinar will help you make that correct decision right up front. The eligible professional that's must be enrolled in the CMS PICOS system, provider enrollment chain and ownership system, and you must have a national provider identifier, an NPI. Okay, so I'm sure you're all familiar with those terms. If not, together with your practice administrator, and I think you'll start the process of your meaningful use incentive program very soon. With that, I will send the program, our webinar, back to Carol, and wish you the best.
Thanks, Bill. So appreciate that. That was a lot of great information. We have one more webinar to record for the final rules library, and that is on standards, and we should get that pushed out relatively soon. Bill, thanks again, and we'll see you on the next recording.